Mhm. Okay, good morning. My name is Callie. It is November 21st, and it's our second to last webinar of the year. We're really excited. 2026, we pretty much already have our webinars and topics planned. I'll be unveiling all of that and sending you all those links and information for 2026 later next month. But today we're here with Michael Fandor, who may look familiar to some of you. He spoke at another webinar earlier this year, and he did such a great job. I was like, please come back. So today we're talking about narrative therapy. And again, if you're just joining us, your camera is turned off, your microphone is muted. You don't need to worry about pretty much anything. If you're here, you're in the right place. Okay, Michael, we can go to the next slide, and I will introduce you. Uh-oh.
Yeah, now it's not letting me go to the next slide. Okay, what happened here?
Okay, perfect. Okay, so I'd like to introduce you to Michael. He brings over 20 years of experience to the behavioral health field. He's a licensed professional with a master's degree and holds advanced certifications in trauma and addiction treatment. Michael has spent much of his career supporting individuals facing mental health and substance use challenges, and he brings both deep expertise and real compassion to his work. He's with the Ranch, Tennessee, as the executive director for our outpatient and PHP programs. And he's known for prioritizing innovative, high quality care and making sure the people that he serves are truly seen and supported. And I have seen that firsthand. For the past 15 years, he's also been leading seminars on a wide range of behavioral health topics. If you've ever seen him speak, like earlier this year, you know that he's not just knowledgeable, he's truly relatable and brings a lot of real world perspective to every conversation. I'm really excited that he's here today, and I hope you all enjoy this webinar. You can go to the next slide. I'll introduce a little bit more about Promises Behavioral Health. So we're a network of addiction and mental health treatment services. So we offer everything from detox, residential, PHP, IOP, all the way down to telehealth. So if you are sitting here today and you are in Atlanta, Tennessee, Pennsylvania, a lot of you are in Texas. We have treatment programs across the country, but especially in those states that we see listed here. Like I said, Michael's from the Ranch, Pennsylvania. So over there, we focus on holistic programming. And down in Tennessee, we have a sexual addiction program. And down in Houston, Brazos Valley, and Dallas and Atlanta are two of our newest treatment centers. So we are growing. And if you have any questions about any of the programming that I've talked about today, again, we emphasize family programming. We have a new family program that's going to be rolling out next year that I'm really excited about. We already do monthly family webinars, but we are going to be increasing that next year. So if you are interested, it's open to even folks that are not a part of a family program. If you have clients that would benefit, I'll put links to that in the notes. So if you have any questions, reach out. I'll connect you to the right people. Okay. Next slide. Okay, so I know a lot of you are here for CEs. If you're already here, you're in the right place. So if you miss more than 10 minutes of this training, unfortunately, we do not collect your email. So you have to stay for the entire time. Also, there's only one user per device. So if you are sitting there with your coworker and sharing one computer, just know that whoever has logged in is getting the CE credits. So you'll need to separate devices, and it can be, you can switch from a phone to an iPad to a laptop, and that will follow you. So no worries about that. After the training, you'll get an email with to complete your evaluation. Once you complete that eval, your certificate automatically gets sent right to you. So that's pretty straightforward. If you have any questions about that process, you can reach out to me in the chat. But again, you should be able to access everything, including the slides, the resource materials that will all go into your attendee dashboard, and including this recording. So you can go to the next slide. Perfect. Okay, so during the webinar, if you have any questions or feedback about the technology, your Zoom account, the CEs, webinar functions, they'll go there in the chat that a lot of you are already using. And then the Q&A, that's going to be separate for Michael. So if if you have questions regarding the actual webinar content, please put those there so we can keep those conversations separate. All right, so next month we have our last webinar of the year, and it's enhancing motivation to change. So if you all are ever using motivational interviewing, that is what this topic is going to be focused on. Collaborative, evidence-based approach. You all probably have already heard of this since a lot of you I know are here as clinicians, but I'll link the registration page below, and please join us for next month. That'll be our last webinar of the year. Okay, Michael, I think I get to toss this to you now. Thank y'all. I'll be in the chat.
All right, thanks, Kelly. Hey, good morning, everybody. As Kelly mentioned, I am Michael Fanjoy, the Executive Director of the Ranch, Pennsylvania, and their outpatient program specifically. So I oversee all of our outpatient program, our PHP, IOP. We have a resident house in Lancaster, and then we also have medical services, psychiatric services, and those types. I've been there for a little more than a year and a half. I've been working in the field for about 20 years. I am a licensed professional counselor. I am a clinical certified trauma professional. I'm a certified advanced drug and alcohol counselor, certified clinical supervisor. I've worked in a lot of different counseling areas, whether it's inpatient, residential. I also do some consulting services with a couple organizations I have in the past to help different organizations get their licensing and credentialing and things like that. So I kind of get into a little bit of all of it. I am very passionate. I love behavioral health. I love working with clients and being able to help them reach the goals that they have and that they identify, and in turn, hopefully, bettering their lives and being successful at whatever it is that they're hoping to be successful at. Narrative therapy. So I think it's very interesting. I know it's probably for a lot of you, it's not as familiar as some of the other therapies that are out there. It is kind of an offshoot a little bit of CBT and things like that. It utilizes and incorporates certain aspects of DBT and things, but it's also very unique in itself. And I think that's what attracts me to it the most. I also, before I got into narrative therapy, it's something I've been using probably for the past 3 years now, and I've done a lot of research on it. And over the years, I naturally found myself using this type of language before I even started to learn about narrative therapy, and that's what attracted me so much. Is uh, it was so natural and organic for me. It really blends well with motivational interviewing. I know Kelly just mentioned that. There's a training. A lot of us use MI. There's lots of open-ended questions. I love having conversations. I'm very inquisitive in my therapy. I'm very early on in my undergrad, my graduate program. Some of my professors used to say, use the Columbo technique to be investigative and inquisitive and, really trying to get into, the details of what's going on with the person. And I think narrative therapy really helps a therapist and a counselor to work and operate in that type of way. And so that's why it was so natural for me when I started to understand that this theoretical approach and the framework of that. So, anyways, here are the learning objectives for today. We are going to learn to understand core concepts of narrative therapy. We will recognize how trauma impacts identity and personal narratives. We will learn to apply narrative practices to support trauma survivors. And then we will use externalization, reauthoring, unique outcomes in understand them in our clinical work. A couple other things. We're going to be focusing specifically on trauma practices too. Narrative therapy can be used in all different types of modalities. It can be used in working with substance abuse clients and addictions. It can be used working with personality disorders. It really can be used in conjunction with other therapies too. It works very well. It gets along very well with other types of therapies out there in whatever we're doing. But today we're going to focus on trauma, and how we can incorporate this in trauma. All right, let me go to the next slide here. I think I need to do something here. I'm sorry, my PowerPoint is, I think, a little bit too big here now. So let me just kind of do this so we can see this. So, theoretical foundations. Narrative therapy is grounded in social constructionism, and it was developed by two people, one by the name of Michael White and David Epstein. Rooting in social constructivism, stories shape, and the idea that stories shape our identity. Focuses on meaning making, language, and personal agency. We're going to talk a little bit about what agency is. Agency is kind of a big key concept with narrative therapy. Agency versus a victim mentality, and what is the idea of those two opposites, and how do we help our clients get their agency and develop agency. Problems are separated from people. That's another key concept, and I know we see that a lot when we talk about stigma. There's a lot of work going on right now that helps to reduce stigma, and I think a lot of us understand that the more that we can reduce stigma, the better that our clients are able to adhere to counseling techniques and improvement and change, because stigma really puts a barrier and a block in even our clients coming to see us and things like that, but also in the work that we do when we meet with our clients. So, narrative therapy, again, it's also very organically built to reduce that stigma, because some of the theories and techniques within it are really geared towards separating the problem from the person. And we'll get into that a little bit later on. Then this idea that stories shape identity. Dominant stories often overshadow alternative stories. And we'll kind of get into that a little bit, and how can we maybe build up and pump up, so to speak, these alternate stories that actually should take front and center, because they're being overshadowed by a lot of negativity. And sometimes those alternate stories are where our strength and our resiliency and our positivity lies. And so in narrative therapy, we're really getting a fuller picture in it, because the dominant story doesn't give you the full picture of what is going on with the person. And so we want to fill in and plug in those things with the alternate stories to really get a better, fuller understanding of what is that person's narrative. And then language creates meaning. And that's another thing. I mean, language is a big part in narrative therapy, obviously, telling stories, the type of language that we use, how do we describe it. Sometimes literary genres can go into narrative therapy, context and things like that. It really goes into the detail of how we're speaking, what we're speaking, and what contextual understanding we have for the understanding of that person. Let's see a couple other points here. Problems are not internal defects, they exist outside the person. And I talked about dominant stories. Here's a little prompt, a little question that I have for you in this. What dominant stories do you usually see your clients tend to carry about themselves, specifically when we're talking about clients that we work with that have trauma? What are some of those dominant stories that they carry with them about themselves? Think about that for a minute. Some of those stories can be, they're not loved, they're not good enough. There are different type of things that people are unsafe, especially certain people, or their safety is at jeopardy. There's a lot of stories there that are good. Nothing's good is happening to me. I'm reading some of the comments here. Yeah, don't deserve better. Yeah, a lot have stories about that they are bad. Yeah, that they're bad people. They unworthy, guilt. Yes. So very good. So this is the dominant narratives of our clients, right? And a lot of you understand that when we start to get to meet our clients, we really get to know their strengths, abilities, preferences, and needs, and we start to understand that there is a lot more to their story than this stuff. I'm broken, I'm a monster, like we start to see, well, wait a minute here. You really take care of your kids well. You have worked at this job for 20 something years, you have genuine empathy and compassion for some of your friends, right? We start to see those traits and those alternate stories that lie within the dominant story. And so the first part of narrative therapy really is to unpack all of that, the differentiation between those two. Up front, you'll get that a lot, especially the first few sessions, the first few groups that you have with these clients. You're going to get that upfront trauma, that this hurt, this angst, this pain. And as a therapist, as a counselor, part of our job is to dig underneath that surface, right? Using the investigative approach, the Columbo effect, constantly asking those open-ended questions and things like that, to help us really understand, okay, this is the surface level. And this also, and we're going to again talk about that idea of victim over agency, victimization over agency. And that dominant narrative fuels victimization. It fuels that this is also happened to me. And granted, that is the case a lot of times. But when we sit in that and when we get stuck in that, it doesn't help us to move forward. And so we want to also identify that we can be our own agent of change. We can create this agency where we have control, we can make decisions, we have ability to change the narrative. Even though that this has been the narrative in our lives, we can gain a fuller understanding, which not necessarily completely changes the story. It helps us to interpret it differently. And that's the idea of narrative therapies. We're not creating all these new stories and trying to do away with like our old stories and make pretend that they never happened. We're creating a fuller understanding of what's really going on using the alternate details on top of the dominant details to help us fully understand our true narrative. And that gives us a better interpretation of what is actually going on, which in turn moves us from victim to agent over our lives. And that's kind of the overall 30,000 foot view of this. I mean, this, we can, this is a 2 hour presentation, narrative therapy. We can talk about this for weeks. So I'm just going to kind of give you bits and pieces of how this works. But in a sense, that's kind of the goal, is helping them understand a fuller interpretation of their narrative by mixing those two dominant, stories in their lives, those two narratives. All right, let's go in here. Trauma and narrative. Trauma can fracture identity and sense of self. Survivors may feel defined by traumatic events. Narrative approaches help restore agency and coherence. We talked a little bit about that already. Trauma survivors are often left with a single story. I'm broken. I'm unsafe. I'm damaged. It was my fault. Narrative therapy helps reintegrate identity by exploring preferred stories that trauma obscures. And that's kind of the idea, is that trauma is, getting is like a distraction, or like a veil that is covering the underlying story that's going on, the helpful, healthy story. And it just gets in that, and it mingles and meddles with it all. And so we want to kind of be able to sift that through and help lift up the narrative that can really build up our clients. And meaning making and coherence are the core to trauma recovery. Some key things that we want to emphasize while we're doing this: safety, of course. When we're working with trauma, we want to emphasize a safe environment, help our clients really understand that they are welcome here, they are, taken care of. We really understand what's going on with them, and we want them to feel that way. We want to understand that This takes pacing. Whenever we're working with trauma, we want to be careful. We don't want to rush things. We want to be careful when we're getting into certain things and how we're able to pace through that in an appropriate way, and not requiring clients to retell the trauma narrative. This is also a key point too. We want to be careful of when we're getting into that. We want to be mindful of how it affects our clients when they talk about some of these things, right? Because sometimes it really opens up a lot under there. And so we want to be mindful of that and, speak to it enough so that we understand and the client understands where we're going with it, but not to dwell in that where they're reliving it, re-traumatizing. That is a tricky thing that takes some time and work to really understand how to navigate that. There's kind of an art form in that to be able to push it along and to connect it, make that connection, and to continue to move forward to that other narrative areas and help them build that up on top of it. Okay. Core narrative therapy practices. So we talked a little bit about this, and here's some core things. Um, Externalization, mapping the influence, unique outcomes, reauthoring conversations, and thickening preferred stories. So a lot of this language you see is used again to give a fuller picture of what's going on. We're not necessarily, again, replacing their narrative. We're helping to fill in the details. We're helping to really put in other areas, that information that they may not have been focusing on, or they may have been there may have been a block for them to even see those areas of information in their life. And as we are, externally being able to view our clients, we're able to speak into that and speak into their blind spots and things like that. So we'll walk through each practice with examples. So externalization. All right, let's talk about externalization here for a minute. So as I mentioned earlier, externalization separates the person from the problem. For an example, the depression is weighing on you versus you are depressed or I am depressed. We probably hear that a lot from our clients. I am depressed. Are you depressed? We may even ask them, are you depressed? We're really trying to shape our language, and the work in this is that sometimes it takes us a few more seconds to say a couple more words to our clients and to really think about how we're communicating to our clients. We talk about, we probably talked about effective communication and conflict resolution, using I statements and those types of things. This kind of takes that concept and really brings it to the next level when we're talking about a lot of things that are going on with our clients. So again, another, the example is versus you are depressed, we're saying the depression is weighing on you. We really speak to the dysfunction as like something separate than the person. We separate it from. We don't connect them to. You are really struggling with substance use. You're an addict type of thing. You're, a lot of times it seems that these types of things trigger an anxious response, or the, type of thing. So we really want to try to really externalize that, reduces shame and internalization of blame, especially crucial for trauma survivors. And then this encourages clients to take a stand against the problem. That's really what we're trying to do. Again, this is setting the tone for developing agency so that when a problem becomes outside of ourselves, now we can take it and we can really look at it apart from that shame and that guilt and that, because if it's just us, there's a sense of hopelessness there. But if it's something tangible outside of us that we can view and we can understand and we can observe, happen, then we can do things with that. We can manipulate it. We can change. We can grow from it. We can learn coping skills and things like that. So that's what we're trying to do. Again, we see that a lot in other types of theories and interventions in counseling, and it definitely shows up here. Open space and agency. Anxiety is showing up again versus I am anxious. All right, next slide. So mapping the influence. Problems impact relationships, emotions, body, and behavior. So how the problem affects the client's life, how the client affects the problem. So that relationship, right? That interplay between the client's life and the problem and the client. And then again, a lot of this still is pushing that externalization process, right? Of externalizing the problem, looking at it outside of themselves, and then identify patterns, impacts, and moments, of resistance. And this strengthens awareness and empowerment and creates a fuller picture and reveals overlooked strengths. Explore how the client influences the problem, any pushback, boundaries, or resilience. So we're also looking for resiliency in the client in different areas that the client may have, because that's a big part of agency, is developing that resiliency to handle challenges, right? And because we all have challenges in life and we all have to deal with them and handle them. And our ability to be resilient over those challenges helps us manage our emotions through it and keeps us clear and level headed, and really to have an accurate picture of what's going on. And so we're looking for those when we're talking to our clients, we're understanding, we're looking for key points of resiliency, strength, connection, so then we can highlight those and start to shape the narrative around those for the client, help the client be able to shift what they're seeing and what is also happening here. And again, that creates strength, it strengthens awareness and empowerment. Some questions in regards to mapping the influence. Um, how how does the problem operate? We want to think about that. How does the problem operate? Where does it come up? Where is it triggered? Those types of things. Um, what tricks or tactics does it use? You know, where does it show up? You know, how does it blindside us or catch us off guard? Those types of things. What parts of the client's life does it target? Those are the types of things you want to think of too. Where does it show up? What parts of the life does it target? And where doesn't it show up? And then another thing is, who helps the problem show up? This is a very interesting question that we can ask our clients: is who helps that show up? Who helps it? Where does it kind of tend to happen more often than not? And we see that a lot with our clients, whether it be certain family members, coworkers, friends, things like that. Tend to see where does it show up more with who? And here is an example. Anxiety tries to keep you isolated, but you still went to work yesterday. That's evidence of your commitment and courage. It's little things like that we want to expand. We want to blow up. How anxiety keeps isolated, but if and when they still follow through with whatever activity that sometimes they are kept from, we want to highlight the times that they made that commitment and that courage to go through those. And the more that we help the client focus on that, again, that's helping them create that agency within them and to help them get that fuller picture of what the narrative is versus ruminating on the difficulties that they're dealing with. Next slide. Unique outcomes. So for unique outcomes, we want to look for times when the problem's influence weakened. These moments are seeds of preferred stories. And again, we're trying to change the narrative, or create a fuller narrative which shifts from the dominant story to a preferred story or preferred understanding of what's really going on with the client. That helps give us a fuller understanding of the person's narrative, the person's story that we're working with. Moments when the problem was less powerful, overlooked success stories. You want to highlight resilience, strength, and values, and help build the preferred identity stories within the client's understanding. And why does this matter? Because this reveals values. strengths, commitments, overlooked identity threads, these are like the seeds to help develop and to grow into a fuller understanding of what of who the client is and where they're going, how they're growing, how they're developing, what they can be. It helps to spread hope within the client too when you're able to pick those out directly from the client's own story in life and from their narratives. And then it's easier to make that connection when you're able to pick that out directly from the client versus hearing it from someone else. Now I know we talk we a lot of times we may use other people's stories as strength and hope. But in this type of approach, what we're really trying to do is use their own story as strength and hope and trying to pull it out of their own story because we if we use that Columbo and that investigative approach, I'm telling you, I'm always astonished. And really this is what I think keeps me so passionate about what I do is that I find that experience, strength, and hope within their own story. You just have to pull it out. You have to be a little creative about digging in and investigative. And that part of the approach for me is I don't know. I just love it. I love that part. It just keeps me, doing what I'm doing. It keeps me so curious because we all have so much going on and we're so different and unique. It's like it's more exciting than the newest movie that's coming out. It's just like learning about and understanding and about people's stories and what we do, our likes, our interests, our difficulties, our challenges, how we learn to get through those types of stuff. It's all neat. And so we're in a sense pulling out the experience, strength, and hope from the own person. And when we're able to do that, we kind of mirror it back to them and help them understand, like, hey, look, you have this inside of you, and so it really helps. And some questions that we want to have here for unique outcomes is, was there a time the trauma story didn't define your day? And maybe even go through day to day sometimes with a person. They might not even be able to interpret that because it's hard for them to even see if there was a time. Sometimes we get so stuck and closed in that we don't really see that. So sometimes just walking through a person's day to day with them and then pointing that out can help them understand that there is times that the trauma story doesn't define their day. Um, Another question we could ask is, what does that moment say about what matters to you? And then who would not be surprised that you resisted the problem? See, there's a thing, there's a great question too. I know a lot of us have people that care about us, and our clients are the same way. Some clients may have more people than others. And if they don't, you can be that person that cares about them. And so when you ask them this question, when you ask them, was there a time the trauma story didn't define your day? And then who would not be surprised that you resisted the problem? You could be like, I'm not surprised that you resisted that problem because I know you have that in you. And again, by us providing positive affirmation and reinforcement of the client and believing them in that agent of hope, we help them to develop their own agency over that and to understand, like, wow, you know what? Someone does see it in me, and it does, and I did do that, and it does make sense. And maybe I can do it again, or maybe I can do it more often, maybe I can see it differently. This is all developing, helping the client to develop that narrative, focusing on identity, values, and capacity. Right. Just looking at a couple of the I have difficulty when I'm doing these presentations to do multiple things. I'm a firm believer of multitasking is a myth. You can do one thing well, or you can do a bunch of things not so well. And I'm trying to do a few different things. So I'm not. I'll periodically look at some of the chat to see if there are questions and things like that. And there will be some time definitely at the end for questions. So if you have a question throughout the training, please write it down, hold on to it. We'll definitely provide some time at the end to ask those questions. So reauthoring conversations. What does that look like? Reauthoring equals expanding stories that reflect a person's values, hopes, and commitment. It helps clients construct new narratives or a fuller understanding of narrative aligned with values that are already there. The values that they have, they're just buried. You know, what are those values? And we can help clients also develop new values for sure, but a lot of those values are already there that the client just needs to uncover and kind of push the junk away, push the clutter aside and see like, wow, there's something that has been buried for a while and it's really under there. Exploring intentions behind behaviors, intention, purpose, meaning. Some questions are, what does your action say about who you're trying to be? Strength, strengthens identity and separate from the trauma. And that's the other thing too, is that a lot of times we take this idea of trauma or addiction or whatever, and it just becomes everything about us. A lot of times we see that with diagnosis. My diagnosis becomes my identity. And I think a lot of times as therapists, counselors, we, might not do enough. I know I get caught up in it sometimes in the day to day where I don't really think about how this I this condition has become their identity, and then to do some work to almost help the client undo that a little bit. Before we even get into other stuff, and just speak that into the client and be like, look, you are not your trauma. You are not your addiction. That's like it's very difficult when some of our people identify themselves as that. It can be counterproductive, and so we want to be careful with that. I know some areas there's different techniques to use that. I'm just kind of pointing out overall in this particular theory, we want to externalize that and separate who we are from our condition, and this promotes hope and forward movement. Here's another idea: is reauthoring conversations builds identity based on resilience rather than pain. This idea of thickening the alternative stories. Again, there's as you look into narrative therapy, you'll hear terms like thickening the story. Again, you're creating a fuller understanding. You're filling in the details. You're filling in the blanks, and when you do that, you can interpret what's happening completely differently when you are able to fill in the details and the understanding and thicken the story for someone. You get a completely different understanding of what is going on a lot of times in these types of situations. And then you're bringing in sometimes you're thickening the alternative stories. You're connecting actions, meanings, desire, and identity, and then bringing in supportive audiences to help with that, to play a role in this. I'm just looking at a couple of the questions. I may respond as we go, but one question was working through catastrophic losses with this. And again, if you want to think of overall picture, right? The overall goal is moving from our that we are a victim to our circumstances to we have agencies to how we are able to work through that. And any loss, pain, we can do that because we are trying to, instead of having that front and center, having the strengths and resiliency. What are some of our strengths? What are you as a therapist in any loss, if there's a catastrophic loss, but a person still has their job, you want as a therapist highlight those things, or they have some loved ones, or they have their health. They're not, they don't have cancer in the hospital. You know, again, you're looking to help a person understand that I mean, it's basically the way that we want to we can understand or believe one narrative versus another over our lives. And remember, this is developed on social constructivism, right? Think about social constructivism. I cut the cord for cable 10, 15 years ago because I realized that everything I watch on the news is negative, and I don't need. I'm like, this is influencing my narrative in my own life, and most of it is not happening in my own life. I mean, for me, I have three little kids. I've married 17 years. I have a beautiful 8-year-old daughter. I have an amazing 11-year-old son and an amazing 12-year-old son, right? I'm building my career. Yes, there's challenges, there's things that are happening, but all of the stuff that I'm feeling negative about was completely blocking me from some of the amazing things that were happening right in front of me because I was diving into this narrative that really isn't even my personal narrative on my day to day, And so that's kind of the type of thing is that there's all of these narratives going around, and what is our ability to have control over that versus letting that control us? And that's kind of the idea that we're really trying to help our clients understand. Do you have control over the narrative that you're believing into, or is that narrative controlling you? And again, it can be with catastrophic loss, it can be with addictions, it can be with any of that stuff. It really is that idea of, do we believe that we have control? And as a therapist, the more you learn about this, and there's tons of techniques in helping empower our clients over that ability to control that versus being controlled by that, by our emotions, emotional regulation, our perspective on lives, our views, and those types of things. So you'll understand more we'll get more into techniques and applying, and right here, we're talking about creating safety and storytelling. So again, a lot of this is to help that person understand that there is a multiple ways to view what is going on in their lives and in our world, and how do we get to that narrative that is more healthy for them versus what is unhealthy for them. So in this section, we're going to talk about attuning to trauma responses, grounding and pacing. A lot of us have heard of grounding techniques. How do we ground into the present moment? How do we ground our clients into today, into here? How do we ground them into what is positive in their lives? And again, if we're not finding that, we might want to do a little more research on how to find and dig out and investigate positivity in our clients. And maybe if we're struggling with that too, because this isn't something that I've been doing, again, I've been in the field for 20 years. I'm constantly finding positivity in people that maybe they haven't found positivity in themselves for years and years and years. Just to the fascination of how we are, uniquely uh, adapted to certain environments and stuff like that. And as a therapist, we really want to maybe do our own self work sometimes, because sometimes I think when we struggle with finding positivity in our clients, that may be a reflection of sometimes what's going on with that side of us. And I'll just do a little self plug, right, on self care. We hear that a lot. Self care isn't always just doing like fun things or enjoying things, not being so stressed out. Self care sometimes is helping ourselves develop ways to have positivity and positive outlooks in life. Because if we don't have a positive outlook in life, how in the world are we supposed to expect to do any help for those that we're working with to help them have a positive outlook in life? So it starts first within us, and to be able to see things very positively. I have a little sign on my desk that says "Stay positive." It's a very big theme in my office. All of my staff know, like when they come into my office, like that is the theme. No matter what's going on, we need to stay positive. And if we can't, we gotta figure that out. We gotta figure that out because that is a big part of what we can, you know, I don't, it's like basically if I'm a mechanic and I don't have any tools, how am I going to work on a car? You know, if I'm a therapist and I'm not able to remain positive, like that's one of my main tools, you know? And so of course our we're going to struggle with some of this stuff. So that's just kind of a side plug. And I know I go on tangents sometimes, but and sometimes we need to use grounding techniques for ourselves. But then when we go into our clients, we want to be careful about pacing too. Remember, I saw when you're talking about trauma, you want to be very careful about the pace that you're going with your clients on trauma. And then honor, you know, you want to honor the client's autonomy at all times. You want to understand, you know, you want to speak to as like, and this is can be tricky, but we definitely want to not be like the experts in the client's lives. We want to, again, when we're curious, we're almost on an adventure with the client. This is another thing as some of the seminars and things like that that I've heard over narrative therapy is like you're like on an adventure with the client. You know, we're on this journey together. And you want to put on your safari hat, you want to go through the jungle and you want to say, hey, we're on this crazy adventure. We're doing this together and we're learning together. So there isn't like, I'm not necessarily the guide. We're going to walk this path together and we're going to work through this together. So you're really validating the experience with the client and they're almost taking control and you want to build them up as the expert over their own lives, pointing out certain things. You know, like, oh, there's a tiger over there. Watch out for that. Oh, there's a Jeep over there. Let's go jump in that. Look at that. We found a Jeep. Yeah, you know, I just watched I was on a trip recently and I watched the new Jurassic movie. And it's just so crazy how we constantly get sucked. I mean, what is this, like the fifth, sixth Jurassic movie there is? And it's basically the same as every other stinking Jurassic movie. But we get so pulled into that adventure, you know, in that fear and scare, but then also that, you know, that achievement, you know, and that hope that they're going to make it and we're going to make it. And then they do, and we can build off that from time to time to time. And it's almost like a mirror of the trauma that we're working with our clients, you know, the trauma rears its head up like the dinosaur, but then all of a sudden there's a Jeep or there's another person there saying, give me your hand, come on, we can get out of this, you know. And then over time they become very resilient through the movie. And in a sense, that's kind of what we're trying to do with our clients. It's a very, very fascinating process. So create safe storytelling. There's one other thing too that I want to mention here in this. Focus on meaning, not triggering content, and repositioning the client from victim to agent. And that's kind of really, again, the biggest thing that we're looking for is we're trying to make that shift. Because a lot of times it's very difficult to not get stuck in that victimization, that victim mentality that you know, whenever you know, you've experienced trauma, you've experienced great loss, you know, and you just can't get out of that. You know, we feel like we get in this victim mentality. And as a therapist, we're trying to help promote agency over that victimization. And here's a therapeutic language that we can use. I don't need you to tell the whole story. I just want to understand what it has meant for you. And that's kind of the idea is we're not trying to help them relive all of it. We're trying to get to the underlying meaning and connection to be able to help them reassign that, so to speak. Okay, cultural considerations. So this is very big. Cultural considerations are what help create our identity, what make us unique in this world, and things like that. And so it's very important to understand that our cultures help shape our narrative. Also, there are unwritten rules a lot of times in our culture and norms, cultural norms that kind of build into the narrative and the overall structure of the narrative. And so sometimes we want to either help our clients understand and accept and adapt to those cultural norms or help them understand that their understanding or interpretation of what some of those may not be completely accurate. And so there's and then maybe that can change. So accept and change, you know. And you see that. I mean, this again fits well with like DBT, dialectical behavioral therapy, where there is that process versus accept or change, and how those interplay with each other. Narrative therapy that can help further the narrative and the story that is going on and how they're creating that fuller story. Stories are culturally, spiritually, and historically influenced. Avoid imposing a therapist driven narrative. This can be extremely difficult for us in what we do because we have so many different views on the way that people should be assisted. We have different techniques. We come from different places. It is very, very difficult to not impose our bias on our clients. And so we want to be very mindful of, first of all, what are our biases? I think sometimes when I do supervision with therapists, and I do a lot of licensing supervision, I've been doing that for years now, six plus years. I've been helping counselors and therapists get their licensing. I help organizations get their licenses, and I'm constantly asking them, do you know your biases? Are you very well self-aware of what your biases are, and how do they interact with your clients? We get into transference, countertransference, all those fun things. And so I think the first step is for us to do our own self-work on, like, okay, what are my biases? Help me to understand them, help me to see how they may interplay with other people, and then help me to avoid imposing some of these therapist-driven narratives in my counseling and in my belief of the person that is sitting in front of me. And I see that a lot, especially in addiction counseling, that pops up a ton on what we are assuming or expecting the client to do or not do, or behave or not behave. We kind of get caught up in a lot of that stuff. We want to protect cultural narratives, and that may include family honor, spiritual identity, community connection, and ancestral resilience, which is an interesting thing that we want to make sure we're working with. And here's an interesting thought using culturally responsive questions, but the idea is curiosity over assumptions. That's a big key idea that I want to throw at your way, is curiosity over assumptions. I tend to observe counselors and therapists making a lot of assumptions of clients often, and I know, a lot of times I say, well, you know what assumption means, and, you can fill in the blank on that. But the idea is what kind of is the antidote for assumption is curiosity, you know, remain in a state of being very curious about your client, constantly curious. It's very interesting. Tell me more about that. Curiosity breeds open-ended questions, the ors, in motivational interviewing. That is like fascinating, and use some validation in your curiosity and just be like, hey, um, it seems like that this very difficult situation that you experienced is consuming your day to day. Like, help me understand, like, how that, how that feels, how that understands, who in your life can see, different strengths in you, start to bring them down a path. Again, as you're exploring, what are their strengths, abilities, needs, preferences? All of our clients have strengths, abilities, needs, and preferences, right? The curiosity brings us down the path of strengths, abilities, needs, and preferences. All along, we're taking notes. We're taking notes, we're taking notes, we're taking notes. And then later on, we want to kind of fill in those notes, and again, curiosity, it makes you, as you're walking the path with a client, you may see a beautiful bird in the tree over there. And you know what? You want to write that down. And then later on, be like, hey, you remember that beautiful bird that we looked at? You remember that smile when you saw this particular person, or that compassion you had for someone who's going through the same exact thing that you're going through? Like, that is the stuff that we want to get into. So curiosity over assumptions. Um, Here's an idea: integrating spirituality and meaning. So consider spiritual narratives that shape identity. Invite clients to include preferred spiritual stories and support meaning making without imposing beliefs. Spirituality can be a strong component in narrative therapy. And so a lot of our clients may have a strong disposition to spiritual practices. And if they do, we can absolutely leverage that and utilize that to help in this idea, because a lot of times that is what some of our clients' spirituality, in essence, is trying to do, is help them to understand hope and peace and guidance and things like that, moving forward, bettering themselves, positivity, a lot of those types of things. So if that is part of what our clients adhere to, then we want to absolutely dig into that as a therapist and start to use that and help them and be curious again. Another area to ask curious questions. What does that mean for you? How does that work? How does that help you? How is it? Those types of things. If it does, if it doesn't, then we're constantly probing for positivity. If we sense negativity or triggering responses, then we move away from that. We go into something different. We're constantly, on a journey with our clients, moving through the jungle, looking for the positivity, avoiding the dinosaurs, right? All right. Applications of behavioral health setting. 1 second here. Okay, so we're talking about applications of behavioral health settings. Um, so this can be very effective in individual counseling, group work, crisis intervention, recovery-based programs, and peer support. It can be utilized a little bit differently in all of those settings. And again, we all have a story, and we all have an understanding over that story. That's what our narrative is. Our narrative is our view or our understanding over our story in a nutshell. And so as a person that we're coming in to help, we're trying to help the person interpret their story, their narrative, in a way that is actually maybe more accurate, more healthy for them. We talked about positivity, those types of things. And so I use this in a lot of different areas in practice where we talk about, their story and how to fill in that stuff. I mean, a lot of times we're using narrative therapy, in different parts and aspects of it without even realizing it. Again, motivational interviewing is a big part of that. Even just trying to help a person uh, develop positivity. Sometimes I'll do gratitude work with a person. If any of us have ever done gratitude work with our clients, we're basically doing narrative therapy in that sense, because we're helping clients develop gratitude and positivity through their own lives and understanding how to make that connection for themselves. So a lot of that is happening. All right, I'm going to take a couple minutes right now because we're doing pretty good on time, Callie. I think would it be all right if I take a couple minutes maybe to look through some of the questions and
Yeah, they're
see if,
they're there in the Q&A for you, I believe.
okay, let me take a look here. Q&A. So where,
At the bottom of your like where you hit the share button earlier, there's a Q&A.
yeah, there it is. Nice. Okay. You say more about the client effect problem, how the client affects the problem. I'm having difficulty with grasping that one. Okay. So part of it, again, is their understanding of what the problem is. The more that we focus on the problem, the more we exacerbate it, right? The more we focus on something, it's what it becomes. And so that's a part of how we can affect the problem. If we believe, or if we're constantly focused on that, this is who I am, this is who I will always be, while we're undermining, or we're not focusing about a lot of the other things that are happening in our life, especially positive things with either work, family, health, whatever that may be. And again, the therapist's job is to find those things, to be curious and go on the journey to help the client understand what it is that they're focusing on, what are they building up, and how to maybe help them change that. And so that's a part of how the client affects the problem. Plus, it could be other things the client's doing in their lives. I like to view a client on a holistic approach. So what are our eating habits? What are our sleep habits? How is our health maybe affecting our mental health? And some of you may have been on my last training where I did the gut brain connection, and how there's more neurotransmitters in our gut than there is even in our brain, and how those all develop, all those neurotransmitters that affects us, and that can be one way on how the client is affecting the problem. So we want to talk about the day to day and what it is the client is using. The mentality of victimization exacerbates the problem. That if I'm just believing that this is my reality. So that's the type of thing. So thank you for that question. Next question is, any comments about similarities, differences of EMDR and narrative therapy? So EMDR is actually very different than narrative therapy. EMDR uses body movement, and it talks a lot about the mechanics that kind of trigger certain areas of the brain to help access different things. Narrative therapy is more of um, it doesn't necessarily look to access certain areas of the brain or of the body. It's to get an overall philosophical understanding. It's social constructivism in a sense. So it's more like philosophical in nature, where EMDR is more somatic, experiential, and physical, tapping into certain places of the brain. So it is actually a very different form of therapy than EMDR for trauma. And that's the thing that I want to, help us understand. There's a lot of different forms of therapy out there that help our trauma laden clients. And we want to be careful of jumping into only one modality, because sometimes, and not one modality is going to work for everyone. It may be very effective for a lot of clients, but that does not mean it's going to work for everyone. So EMDR is an amazing form of treatment. There's also cognitive processing theory. There's other thing. I don't know if any of you are familiar with brain spotting. That's something my wife has recently gotten certified in, and she has been very effective in treatment. Narrative therapy, DBT can be very effective for trauma. So we want to definitely be thinking about that. But yes, that's for EMDR. What was the last thing? Um, what was the last thing it said? Builds identity based on what rather than pain. Oh, jeez. Um, I do not remember. I'm
I
sure if
think
that's
it
in my
was,
notes.
I think it was when you were talking about how people can often
Resilience.
create their identity
Found
based
it.
off of their, oh, you found it. Okay, yeah.
I found it. Yes. Build identity based on resilience rather than pain. Resilience. Can narrative therapy techniques be effective with schizophrenia, manic, or psychosis episodes? Um, yes, that's a great question. I do not have the answer to that question, nor do I have experience with that. One thing I would say is, as long as clients, those types of um, disorders really need, psychopharmacology intervention. And I would probably think that as long as they have that psychopharmacology intervention to help them manage their symptoms, then yes, it can coincide with that. But again, I'm not experienced with that. So great question. Sorry, I don't have an answer for that one. Next one. I'm wondering if you have advice on how to frame this for teens who don't actually have that much control in their lives. Well, remember, this isn't necessarily about control or lack of control. This is about understanding that that their narrative is about creating a fuller narrative, a fuller picture of what's going on. So negativity versus positivity. Now, how much control can also be subjective too. What type of control are we talking about? Are we talking about control over, oh, I get to take the car and go wherever I want, or I go get to eat whatever I want? Or are we talking about the control of, I can choose to either be very unhappy, bitter, and resentful towards someone, or I can choose not to. So if we're looking at that type of control versus I get to go and take the car out somewhere, they might actually have a lot more control than we're giving them credit for, because we're talking about internal control, not necessarily external control. And then narrative seems to be culturally and transcultural archetypical narratives seem to carry over throughout the ages. What does it mean when we feel compelled to replace perennial stories such as Thanksgiving and Christmas with Tom Hanks Day and Kwanzaa? Again, the we as we're on this journey, really the tour guide is our client. So the more we explore this crazy world, their world, their fascinating, interesting adventure, they're actually the tour guide for that. So however they interpret those types of things, we can help guide them through that. And we're always looking for positivity versus negativity, healthy approaches, versus unhealthy approaches. So, if there is some trauma, with them identifying Thanksgiving, and that's a kind of a trigger thing, that's almost like the dinosaur coming out and like, okay, if Tom Hanks Day is cool for them, or if even just going out for a cup of coffee or getting a great cup of coffee on their own with a friend on Thanksgiving and doing something like that is healthier for them. You want to help them play that out. And what you're doing is you're taking victimization over agency. So you're helping them to make their own decision for themselves and be confident about that, whether they want to do Thanksgiving or they want to do Tom Hanks Day or they want to even just go for a walk in the park by themselves. It's their agency, and they have control over that, and they can continue to develop that themselves, whether or not maybe they do it this year, or maybe, what, I did it this year, but I want to do something different next year, or I want to start a new tradition. So great question. Next one. Does that not also make them feel invalidated by trying to compare the good and the bad in their lives? How do we work in allowing? So we're not necessarily comparing them. I mean, maybe I misspoke, or you maybe it wasn't understood. We're pointing. We're just trying to guide them to their. Usually, what's happening is they're not seeing positive things in their lives. So we're not comparing it. We're not bringing them up and be like, oh, here's, the way you act this way. We're just saying, oh, they may be talking about that, and then they may be talking about this, and then we're just focusing on this. We're not comparing. We're just saying, hey, if they're talking about like, I'm always, you're looking for creative ways to highlight in their lives, not to compare, but to highlight and to bring focus to. I hope that makes sense, because we're not necessarily saying, we're not bringing the two up against each other. We're just, as we're on this journey and we're being curious, open-ended questions in conversation, getting to know them. We on ourselves, on our personal notepad, we're taking notes on what is positive. And then through that same conversation, we're trying to find ways to bring it about and to help shift the narrative, not necessarily compare it. Um, find it. I find being positive isn't helpful as being hopeful. Okay. Next thing, thinking of how I can use narrative therapy for a client who has high functioning autism, accepting the reality, but adding an agency, resilience, and get out of fear and avoidance. I don't have too much experience with autism, but I would definitely love to hear how this could apply for that. I'm curious how you guide therapists to not paraphrase clients' narrative through their own lens. I've found rest. I don't know if they finished typing in that one. I'm curious how you guide therapists to not paraphrase clients' narrative through their own lens. So again, you're kind of guiding them through it and you're making observations. So it kind of is through their own lens, but you will start to understand there's a dominant story and then there's an alternative story, even in their own lens. And what you're trying to do is take notes on that and help to highlight that alternative story, that non-dominant story, which usually is there's certain things in their lives that they are missing, so to speak. And then you kind of point those out. You kind of be like, oh, let's talk a little bit more about this. I'm curious to, you mentioned, this friend of yours that you connected with, different things. I mean, there's hundreds and millions of examples. I couldn't go through all, but you again are going through with them and you're picking up details that they're missing. And then eventually finding a way in conversation to help them see some of those details that could possibly help them gain hope, positivity, whatever you want to call it, to help them move towards that area of a more healthy living. What is the best way to be curious with clients' experience without the client getting frustrated that you don't understand? Um, it is a trick. I mean, not a trick. It is like it takes practice. Absolutely, just like open-ended questions take practice. This for sure takes a lot of practice to be able to navigate this with your clients. I mean, I think by being, I think most clients, you're not trying to be manipulative, and so if a client gets frustrated, then maybe you're trying to push it too hard and be manipulative. There isn't a time frame here. Sometimes we're in a rush as therapists. Sometimes we're trying to get our agenda. Our agenda isn't necessarily, oh, I got to get this in so many sessions. It's no, let's have this conversation. Let's go on this walk. And without the client really even knowing, I'm just mentally making note of some of these other things. And then if I can find a way, or I look for opportunity that presents itself organically and altruistically to be able to bring those things up again, to help shape and help fill in the fuller understanding. Now, again, a lot of our clients are very accustomed or conditioned to their negative, unhealthy response, and we can't own that on them. If they just want to stay in that and they're very, very much having difficulty coming out of that, we just keep doing what we're doing and let them, and keep pointing out what they point, but we don't take ownership for their own ability or inability to move out of that negative, that unhealthy victim mentality. We want to create agency over victimization, but ultimately it's their task to do that, not ours for them. How do you balance off how much focus on problem, feel the emotions that come up when talking about the problem, or recalling a memory versus how much you start thinking in the rest of their narrative? Yeah, these are great questions. This all takes time and practice, and it's different for every client too. I mean, there's almost like individualized type sessions where you can't have exact parameters around it. It's kind of like you're walking into some of these things and you're just working through that. So you got to feel that out. How much time do you want to thicken it? How much time you want to let the client talk with these things? I mean, it takes time. Usually it's over a few sessions. You want to develop this as you go. All right, a couple more questions, and then I'm going to move on to the PowerPoint. How can you help a client who returns to an old narrative when anything does go their way, they return to it? Why does God hate me? So clients are absolutely going to return to old narratives, and that's definitely, a tricky thing. Um, you want to give space. This is another thing too, is there needs to be space given to our clients to be able to, we're walking with them, but we're giving them space. We're not smothering them. We're not forcing into this. We're having a conversation. For as much as they allow us to have the conversation with them, we keep our composure. We be careful about not getting sucked into their stuff, because that can happen a lot, get spun and all that stuff. But at the same time, we want to take notes and be curious, and allow us to have that, and allow them to have that space at the same time. But there are tenets that I mentioned too, is that we want to help them focus on the problem. They are not their problem. Sometimes by us helping them focus on that they are not their problem, that this is an external thing, it helps that rumination and that constant, connection of like, I am trauma, I am trauma. If we help them pull that away from no and use language to speak to that, that can help them from not focusing on that so much. But there's a lot of different techniques in this that I've mentioned that help our clients not to focus on that as much as they can. And again, we do the best that we can through this. Um, are you saying a goal is to steer clients away from negative and triggering memories or feelings? Might it work better to consider authenticity versus positivity? Also, sometimes people are actually victimized. Can you speak to the difference between the victim mentality versus validating a client actual experience? My thought is that the victim mentality is not really about true victimization, but rather losing ourselves entirely within trauma and being able to see outside of what occurs. So yes, we are definitely victims of things, but I tend to understand that people have a lot more control over our thoughts, feelings, actions, and behaviors than we give ourselves credit to. And so it's just like it's like a lot of things, like with depression, with anxiety, you know, over periods of time we succumb to these types of things, and we lose sight of actually our ability to be able to develop coping skills, develop new patterns of behavior. And victim mentality is denying that ability. So I believe everybody has the ability to develop a new to grow, develop. We're constantly growing, just like the seasons are changing all the time. Nature, I'm a big naturalist and believe in how nature and influences and mirrors things that even go on inside of us. And so victim mentality is when we get stuck in that idea that we have completely no control or ability to influence and affect the things that are going on within us. And as a therapist, we definitely want to be careful about how we're shaping that and talking about that. I don't ever really talk to my clients in those types of ways. Some of the terms that we use are just for therapists. I don't tell them that you're in victim mentality. It's something I observe, And so I hope you understand that when we do these trainings and when I do trainings, I'm speaking to you all as therapists and professionals, that there are things that we're talking about in ideas and constructs. This is not how we talk to our clients. These are underlying principles to help us understand what is happening with our clients so that we can get a better framework on how we go into that. In normal conversation and the Columbo effect and curiosity, those are opposite from me saying you're a victim, you're in victimization. So I hope you understand when I say, like, when we talk to our clients, this is the way we talk. But when we see what's happening in the constructs in some of our clients, this might be helpful for us to understand what is happening. So those are two very different things. All right, let me continue on just so we can get through this, and then I'll answer some more questions at the end. Thank you so much for your questions, though. These are great questions. Very, very good. All right, applications. All right, so I think we talked a little bit about that. Let's go to the next section here. Case example. Um, clients, client with complex trauma, feelings defined by past abuse. Externalization, naming the silence as the problem. So here's an idea, right? The client with complex trauma feelings defined by past abuse, they isolate, right? They a lot of times they close off. They have walls built up. They're sometimes quiet. These are certain, whatever the attributes that are in this particular situation. This client is very closed off and silent. So as a therapist, you're observing that, you're understanding that, and then you're helping the client understand that the problem isn't necessarily that they've been abused. Like, this has happened, right? This is a real thing that has happened to them, and you don't want to necessarily identify that as the issue. The challenge is they're not communicating, right? If we're not communicating, how are we going to be able to understand what's going on inside of them? So we can name the silence as the thing that we're trying to, using unique outcomes, moments of speaking up or connecting. And so this is the idea, okay? So if you name the silence as the challenge initially, then you want to look for times in their lives when they did speak up. You know, whatever that may be, whether it's speaking up on the approach that you're using to them, whether it's speaking up to their family members or something like that. You want to try to help them understand. You want to observe and identify patterns of silence and avoidance and building walls as you're communicating and you're learning about them and you're asking them open-ended questions and things like that. Again, this is like on the side that you're observing. And then you're like, okay, I'm having this conversation with them. I'm not telling them that they're being silent or not being silent. In my mind, in my head, I'm going to name the silence as the issue, and I'm going to look for moments that they're speaking up. Then I'm going to identify a way to kind of repackage that to them and look at it and say, hey, you know, what if we looked at it as the challenge was just this? And if that was in fact the case, here are some areas where you spoke up. What do you think are the differences there? You know, how were you able to speak up in this particular type of situation where in a lot of these you're not? And help me explore that with you. Is there any way that we can kind of mesh, could we take some of that, could we tap into some of that strength, abilities, preferences, some of that strengths that you have in this area and carry it over to this other area, you know? And that's what help the client develop that preferred story. Narratives are happening all the time, mostly in our unconscious. Narrative therapy isn't like, hey, we're going to develop the story that's not happening. The story is already happening. We're just looking at it and seeing it for what it is. And so we're helping them to understand that, hey, look, this is a narrative. This is your understanding about yourself. And this is another alternate version that is equally true. You know, which one would be more preferable for the client? And we're trying to help them to see that, to pick it out, pick up the details, those types of things. Very investigative approach. All right. Dominant story. Here's another situation where we would have a dominant story. I don't have a voice because of my past. Externalize. The silence tries to shut you down versus focusing on the past. We're focusing on the present. Unique outcomes, times they spoke up or sought help. And that's kind of the idea, is that you're externalizing instead of focusing on their past, because that's a big part of what's going on with them. We're focusing on the fact that they have ability to be silent and they have ability to speak up. And so how does that now start to change their narrative about their past? Well, yes, I feel that silence shuts you down. You don't have a voice because of your past. But I'm very curious what happened here the other day when you did speak up. Where does that fit into all of this? And you're trying to break that rumination, because that's what we see as therapists. And we could be very curious. I don't have the answers to that. I do see that you're saying this, and yes, at times you are silent. But then yesterday you were telling me about your sister. You got mad at your sister because she stole your hairbrush, and you told her like she can't take your things anymore. So help me understand like how that can show up in you, and eventually you can have these conversations to help reinforce that. Now, again, understand, I'm not a purist in any therapeutic technique. I believe that we should be that I am integrative in nature in therapeutic. Some techniques work great for some don't work for others. Please understand that we want to get better at lots of skills in different therapeutic techniques, and this is something I encourage my staff constantly. What are you learning? How are you growing into that? What are some different skills? This is just one practice or one theory that can be helpful for some clients in your practice. Okay, next slide. Clinician skills for narrative practice. Curious, non-pathologizing stance. Use of open-ended questions, story rich questions, conversation. We're trying to have conversation. Sometimes it can have something to do about the issue that they're coming to counseling for. A lot of times it's like, hey, we'll get talking. I mean, I'm a person who loves snowboarding, right? So if someone comes into my office and they start talking about snowboarding, we're going to talk about snowboarding for a while. Even if we're talking about that, though, I'm still going to try to pick out things in their life that are positive, that maybe down the road I can help them make that connection. That's the thing. Is a lot of times you can use shooting the breeze as a therapeutic technique as long as you're doing it intentionally. um, Ability to hold space without steering the narrative. That's the other thing too. A lot of some of those questions were focused on steering that narrative. We're not trying to steer that narrative. We really want to understand that. Sometimes it takes a lot of practice. You know, if it seems like a lot of the some of those questions. That's because we're in that mindset of like, okay, this is steering this. This is we're not trying to steer that. We're really observing, and we're just reflecting back at current times. And then it's collaborative in meaning making. So you, as you're reflecting back, you're not you're trying to have a collaborative approach, and whatever the client makes sense of it. And if they go in a certain way, then you pivot. It's constantly pivot and move. It's more. It's like a dance. Okay, sorry, I didn't mean for you to take it that way. Tell me more about this. Let's talk a little bit about that. There's no stance here where you're just plant your feet in the ground. Um, Avoid curiosity, open and non-expert stance, seeing clients as an expert of their lives. And so this is the other thing too, is that we're not taking an expert stance. We're constantly kicking back to them, and be like, okay, we're learning from you, learning about you, but we're not going to just also at the same time let them steer us in a certain direction. Just like we're not going to try to steer them in a certain direction, we got to be careful of them steering us in a certain direction. That's actually more of what we want to be careful of, because they're going to take us down this path, and we need to understand there's more to them than where they're trying to take us. And I think that's more about what we're trying to understand here. Not that we're trying not to steer, we're just trying not to let them steer us down the path. We're walking with them, but at the same time, just like you're walking down a path, you want to point out things and say, "Hey, look, where are you taking me? Where are we going? What about this part of having a? Remember you did this, or why wouldn't we go over here?" You're asking them questions, or as you're letting them kind of take you where they're taking you, that type of thing. Okay, next slide. Experiential exercise, reauthoring, participants write it down. So here's an exercise. We can't really do it in this format, but I want to leave it for you, and maybe you can write it down as something that you can do on your own or in your own practice. Participant, like your client or yourself, can write a dominant story, usually something that is a challenge, and if we were in person, we were doing a seminar right now, I would say, hey, write a story about a challenge that you have, maybe something with your job, maybe with a family member, could be like, I'm very frustrated that, my employer is dot dot dot, or my husband never listens to me. So we can use that as like the dominant story, or sometimes we can even expand upon that as like, usually no one listens to me, right, type of thing. And then you want to rewrite a preferred story, in that same sense. I prefer to, you want to use specific examples too. It's a dominant story. Here's one situation. I'm overwhelmed, by communicating with my husband or something like that. And then a preferred story is, my husband or my wife values time together with me. My husband or wife's strengths are dot dot dot. Intentions are this, that, and the other. So you can do that. You can put, your loved one. You can put your employer in that. You can put your children. That's probably where I would throw that one in there. And then you put like what you're interpreting, what's happening, and then you try to fill it in with like, okay, if I'm talking about my kids don't ever listen to me, right? And I'm so frustrated with them. So that's like the dominant story. The first story is my kids are all doing really good at school right now. They all have decent, really good grades. A lot of them are active in sports. They have great friendships. So how does that interact with the first story? Dominant stories, the kids never listen to me. They never do their chores. We're always going at each other. And then the preferred story is my kids are doing really good in school. They have really good relationships. They're healthy. They're active. Like where does those fit? And how do I, if I'm focusing on one story versus the other, how does it affect me? If I'm constantly focusing on this story, what type of mindset do you believe that I will be in a lot of times? So my wife walks in the door and I'm like, oh, my kids don't listen to me. They're not doing their chores or this and that. And all of a sudden my wife walks in the door versus I'm like, you know what, man, my kids, they just brought home some great grades. Yeah, they may not listen to me, but man, they did great in their sports. They have a lot of good friends. And then my wife walks in, that's kind of the idea of like, how does it shape our mindset? How does it shape what we think about? How does it shape our thoughts and our feelings and our emotions? Again, this is one technique, one idea, one method, and there are, sometimes it works for some people, sometimes it works for certain things and not everything. And sometimes if it doesn't, then we, yeah, absolutely need to use something else and go into, and we should be using it in conjunction with other therapies out there. And then, so the question ultimately is what changed when you shifted the story? So write one story, write another story, and then what changed when you shifted the story? And you want to make those observations for yourself. Okay, documentation. So when you're documenting, this idea is this fits very well with strength-based psychology. I'm not sure if any of you are familiar with strength-based psychology, but this fits very well with strength-based psychology. So you want to use strength-based language. We want to use strengths, needs, abilities, preferences. And a lot of times we have to use that in our documentation anyways. You want to avoid labeling statements. Like of the client. You want to document unique outcomes and preferred identities. And you want to reflect client agency and progress, their ability to make their own decisions and to understand what shifts and how they had the ability to make that shift. That's a lot of times when we're creating these fuller narratives, we're helping their client that they can make a shift in their perspective and the way that they view the story at hand. The two of us can be watching the same movie and have two very different understandings of what we're seeing in that movie. That's kind of the idea of what's going on here. And instead of like documenting, certain things, we want to document that strength-based value, resiliency, agency. Client is working to protect themselves from vulnerability. We explored how safety can support connection. That could be a term to kind of instead of client is resistant. Ethical considerations. We want to respect autonomy and cultural frameworks. You want to avoid re-traumatization. Again, this is tricky. We're not getting into the details of the trauma. We're talking more about how that's affecting the way that they're looking today. Again, about the silence versus having communicating. When were they communicating, and why do they view themselves as that they have to always be like like this way, and just kind of again mirroring that back to them. Respect cultural and spiritual meanings, maintain boundaries, ensure informed consent for narrative exercises, use grounding techniques regularly. So definitely want to use grounding techniques, keeping them. I mean, this is very much a here and now approach to trauma. And that's the other piece too, is we're really focusing on the here and now, present moment, grounding in today type of stuff. We can through conversation, of course, they're going to talk a little bit about their past, and then trauma. A lot of times, a lot of trauma therapies are to necessarily open that up, but we don't want to, in this particular type of approach, we're not trying to stay there. We're trying to bring it more back to the here and now and our ability to reshape what is in our ability to help heal ourselves in what we're dealing with. Okay. So I have some key takeaways. Um, Narrative therapy is collaborative, respectful, and deeply empowering. Stories shape identity, and identities can be written. That's really a new thing. Stories shape identity, and identities can be written. Therapy helps reclaim them. Language is intervention. It's another really good one. Language is intervention. Clients are experts of their own lives. Um, Narrative therapy gives trauma survivors a powerful opportunity to rediscover who they are beyond the pain. Thank you for the work you do and hold space for these stories. All right, we have some time now for questions. Let me pull this up here. The Q&A. Okay. Callie, I think I'm trying to see which, because some of these are the questions I asked before, so I
I
don't
think I
remember.
removed all the ones
Did
you
you? Oh,
answered.
you did? Okay,
Yeah.
perfect. Perfect. That's what I was trying to ask. All right. So, first question, how would you navigate working on agency versus victim mentality for a client who is blaming themselves for traumatic loss? Seems to be taking on too much agency, I think. Again, agency is um, understanding that whatever it is that they're dealing with that is hindering them, that they have the ability to overcome that. So I don't think that question, we're not fully understanding agency versus victim. And I mentioned a little bit ago too, we're not telling the client this. I'm not telling them this is what I'm doing. I'm not telling them that you're stuck in victimization. The way we communicate it and the way that we view this can be two very different things. Our language, is part of the therapy. So we definitely want to be very careful. But what we're observing is that they're very much stuck in the fact that they're blaming themselves for the traumatic loss. Well, that is not agency. That because they would be able to understand that they're not responsible for their traumatic loss. That is kind of what agency is. And so we're trying to help them understand and grow in that using these other techniques. What is the best way to be curious with clients' experience without the client getting frustrated? I think that one, I think I answered. What is the best way to be curious without them getting frustrated? I think there was a very similar question I answered before with that one. Are you saying to steer the clients? Yeah, this one I think I also answered before. Can you model how you would provide psychoeducation about trauma and its effects using narrative lens? It's an interesting question. Model how you would provide psychoeducation about trauma and its effects using narrative. I think the way that I would educate is I would educate on how, trauma affects our story. If we're using narrative therapy, we're going to educate on, okay, how has our trauma affect the way that we're interpreting who we are, right? And so you can pinpoint that. You can talk about trauma in general. Trauma really is impactful for certain people. It creates this dominant theme because it physically hurts. We have physical pain. The body keeps a score. Some of us have probably read that book, learned about that. So there's this physical thing, and so it influences our narrative. It influences our dominant thing. And then I would go to, okay, this is what we can do is we can understand and an educated point, we have this dominant theme, this dominant narrative, and we have this alternate narrative. And then educate on how we get to that by using some of the techniques that we talked about here today. Would it be possible to hear what an example would be of avoiding a therapist driven narrative? Sure. I mean, it's our biases, right? So again, I've been in the field for about 20 years. Half of my career was in drug and alcohol. When I first switched over to mental health about 10 plus years ago, I was working with some severe psychosis and schizophrenia and certain clients like that. And I, for a while, my therapist, my mentor, called me out on this. I thought they were hiding something from me. They were using, and they just were getting around it. And so I had this lens. I had this lens that I viewed a lot of my clients through my experience and through my understanding of counseling. And that's a lot of times what we get caught up in is really through our experience in our education, in our understanding, help shape our practice. And so I think by us learning about that in ourselves, that helps. Now it's very difficult to compensate or overcome biases, but part of it is self awareness as a therapist. And then by keeping in general and really letting them lead, that's what can help us um, to avoid therapist driven narratives. Is really finding that ability to be able to, okay, you lead me where we're going. We're going to go on we're going to have a conversation. We're going to go on a journey, and you just tell me about yourself. Tell me about some of your life. We'll kind of go here a little bit. We'll go there a little bit. Open-ended questions. Going on this journey that they're guiding you. You're asking certain questions that kind of help them guide you, but they kind of bring you down in those places. Now you want to be careful. Sometimes you want to pump the brakes and say, okay, I don't necessarily want to go there, but you're not necessarily bringing them somewhere else. You're just pumping the brakes and saying, I don't really want to go there. Can we go somewhere else? And then let them lead you to that other place. That makes sense. I think that Nietzsche was on this sort of subject when he said something of the fact that if you have sufficient why, you can handle that why. Yeah, that's great. I mean, it's very philosophical in nature. I love that. How would you hold space for suffering? For suffering in narrative therapy is not as not to spiritually bypass it. How would you hold space for suffering in narrative therapy so as not to spiritually bypass it? I'm not sure I fully understand that question. It's an interesting question. I'd have to think about that for a little bit more. Is narrative therapy, in narrative therapy, is it a good idea to have to look at their story from observer's lens? Yes, absolutely. That's exactly what we're doing. We're like watching the movie, we're like, but we're interacting at the same time. It's like you're as they're telling you this, they're the expert, they're the director of their story, and they're telling you about the movie, but you get to ask questions. Kind of like I'm talking about my Jurassic Park movie, and I talk when I watch movies. Sometimes my family hate it. I'm like, "What are you doing? Where are you going? What's he going? What is he looking for? Oh, go over there, go over there, go over there." And so you're kind of able to. This is their movie, their story, but you get to interact with it. You get to ask questions, and that kind of helps shape where you go and where they lead you in their story, and then it helps them understand a fuller picture of what their story is. But yes, an observer lens is a good way to look at it. I'm curious if you got into narrative therapy because you are naturally a writer. This seems to be something that is wonderful for creative therapists. Um, I am not necessarily a writer. I'm a storyteller. I do like to tell stories, and I like to understand things through stories in the world. I've written a couple stories, but I'm not a huge writer. But I would agree that if you do really enjoy writing, this could be very, very helpful in understanding. You probably could adapt to this well for sure. How do you address clients who are focused on people in their lives needing to change and blaming them? Yeah. So this is again their narrative. They're caught up in blaming and in resentment and those types of things. And you really want to try to help them. One way as you're going through the story, you want to look for the opposite of that in their story. What is the opposite of them blaming? And point that out to them and how maybe blaming could not be beneficial for them. Those types of things. Do you integrate some of the theory into the session so the client has an understanding regarding the approach utilized? I do. Yes, I do. I love to educate what we're doing. I'll educate them on saying, hey, look, we're going to talk about, I want you to educate me, help me understand about you and your life, and you lead me down the path. Let's go for a walk on, who you are, and I may ask you questions when you say something that try to just to learn more about who you are and things like that. And sometimes I do educate. Again, there's certain things that I might not speak, like I might not say, hey, I'm looking for your victimization versus, agency, But I would say, hey, look, this is kind of the tenets of what we're going to do. I'm going to use narrative therapy, and it kind of follows this approach. And we're going to talk about this. I may educate them on victimization versus agency, but not necessarily point it out to them. I may say, hey, these are some of the tenets of what it is. Let's have a conversation. And see what they come to. If they come to the conclusion of whether they're falling in one versus the other. But I definitely believe education is a big part of it. Uh, Homework in narrative therapy, other than gratitude. Yeah, homework is great. So homework would be to write a story. The best homework you could give them. Tell your client to write a story utilizing what and try to point out their dominant theme. What is a story of write me a story of your past 3 months overall in general. Like, what are the key things that have been going on with you over the past 3 months? And then let them read that story to you, and you pick the dominant themes out of that. And then that can also help you um, go down different rabbit trails. That's kind of what you want to do. You want to find side trails and stuff like that. I think that's probably why I'm good at this, because I am a squirrel follower to the 10th degree. I'm constantly going down rabbit trails. So yeah, that's one way you can definitely add homework, is have them write a story. You must also be careful about documentation as it impacts domestic violence in the legal system. Of course, yeah, of course you want to. And again, you're really keeping it in the here and now and things like that. So you want to, really document the work that you're doing in the session. I got lost in your explanation of the experiential exercise. Do they write a third story after the first two? No, they write one story of what is happening, and then they write another story of what they would prefer to happen using their values, strengths, and intentions. And then you ask them, or the conversation is what changed when they shifted the story. What was the differences in how the stories shifted when they put in their values, their strengths, their intentions, their preferences? That's kind of what you do. This is great information. Has me wondering more about separation of the story as a part of who the individual and language is, using myself as an example. I've been in recovery for 12 years. Personally, strongly identify with my SUD and the traumatic experiences and active addiction. I have found it to be so empowering to identify as an individual with SUD who have gone through the trauma, because the outcome is my resilience, strength, and courage, etc. My question is, if I was a client and came to you and spoke this concept, would the NT be not applicable? Is this problematic in the eyes of the NT? My wondering is NT come into place applicable more scenario. So what I would say, again, it's your story. I wouldn't say that this is applicable or not applicable. There are some tenets about this, but you're going on with the story. And what you just perfectly explained is developing that agency for yourself in your own way, in your own story. And so the idea is the agency is how you kind of take control over your life and over the challenges that you're facing. And there are a lot of different ways. You mentioned you have gone through your traumas and outcome, and you have the outcome is resilience, strength, and courage. That is agency. You just defined it right there. So there are a lot of different ways to be able to develop that. And that's what also is so unique about this is it's so broad. There's so many different ways to be able to navigate this with clients. How does IFS therapy work when they're not exactly sure. Internal family systems. I have used it a little bit with IFS, but not a whole ton to be able to answer that question. All right, I'm gonna just go through a couple more questions. So you guys are great. You're asking tons of questions here. I really appreciate it, but we're coming up towards the end. So I'm a graduate student and currently have a huge interest in reality therapy and choice theory. How does narrative differ from those concepts, or is narrative therapy something that could be utilized in tandem with these? I definitely believe it would fit very well in with reality therapy and choice theory, more so than like EMDR. It's definitely more on that type of an approach. because what you're trying to do is take control over your choice, to understand that. And really, it is grounded in what is reality, because a lot of times our dominant narrative isn't necessarily what is actually happening. You know, we might actually have great relationships in our lives, but because we view it this way, or we're subscribing to this one narrative, it's overriding the fact that there are some really great people in our lives that we actually are having great relationships with. So I think it could go very well with that. Great question. Have you had any experience with ketamine therapy use in expanding or breaking identification with trauma stories? I have not had experience with ketamine therapy. In like the Eastern Pennsylvania area, ketamine therapy is growing, and it is a fascinating phenomenon that's kind of happening right now. But I have not explored ketamine therapy or any psychedelic treatment therapy at all. So it'd be interesting to see. I'd be interested to read some articles on that. People did explore narrative therapy and that. How can people diagnosed with borderline personality disorder benefit from narrative therapy? I think a lot of times people that are diagnosed with borderline personality disorder have a strong disposition of the way that they feel that people look at them, and how they should interact with those people. So again, I think it can help. I definitely think it can help a BDP, because it helps them to break those preconceived notions of how they should act and interact with people around them. So I mean, we could get into this all day long. I don't want to get into it too much more. Callie, I will turn it over to you. Thank you so much for all your questions. This has been excellent. Great training. And please continue to educate yourself on narrative therapy. I think that it's a newer form of therapy, and there's a ton of seminars out there. There's a lot of research out there, and it's definitely one that's up and coming and growing. So thank you so much.
Thanks, Michael. And I will just add that if you have any, Michael, if you see any questions in here that if you want to read through them, we can add them to our resources section after the webinar, then we can also touch base if there are some that, we really need to touch too. I think there are a lot of really great questions around this. And then last thing
Sure.
I'll just add is again, next month, December 19th is our last webinar of the year. So same time, same place. Make sure you register on the course page, which I already shared. And the recording, our resources, and the slides will be available by next week in your attendee dashboard. If you need CE credits, that survey will come to you directly after this, and your certificate will be right there. So let me know if you have any questions. Thank you all for joining us today. Great job, Michael. This was awesome. Y'all have a great
Thank you so much.
weekend and happy holiday.
Yes. Same
We'll
to
see you
you and
next month.
everybody there. Thank you so much for attending.
Bye.
Bye.